Hello, and welcome to this short presentation on cognitive reserve in ALS. My name is Emmet Costello, and this research is carried out in Trinity College Dublin and Beaumont Hospital. In this slide, you can see an overview of my poster. Over the next few minutes, I'll go through each section in some more detail. Cognitive impairment is a common feature of ALS, affecting up to 51% of patients. One of the things our team became interested in was the question of why do some individuals develop serious cognitive impairment while others do not. This led us to look into cognitive reserve. Cognitive reserve is a hypothetical construct used to explain how some individuals maintain normal cognitive functioning despite advancing neuropathology. Cognitive reserve theory stipulates that enriching experiences like education, occupation, and leisure activities increases a person's neural resources. This allows high reserve individuals to compensate for the effects of neuropathology for longer. One of the primary obstacles we face in longitudinal ALS studies is a high rate of attrition. Dropout is usually non-random, with patients who are progressing quickly the ones who are more likely to drop out. A novel statistical modeling technique that can overcome this limitation is joint longitudinal and time to event modeling. This utilizes both longitudinal mixed effects models and Cox survival models, which allows us to incorporate non-random dropout in our longitudinal outcome. 179 ALS patients were seen for neuropsychological assessment 4 times at an interval of 4 months. Cognitive reserve was measured by combining occupation, education, and physical activity data. The neuropsychological assessment that we used included the ECAS, tests of executive functioning, language, and memory. This slide shows the results of our joint models. Individuals with high cognitive reserve are shown in red, medium in blue, and low in green. The first thing you'll notice is that the 3 groups are quite distinct, with high reserve groups doing best. For ECAS, language, social cognition, and executive function, we see a consistent pattern where high reserve groups do better over time. However, for memory tasks, we see a pattern where the high reserve groups do better at baseline, but then they decline quicker over time. These findings suggest that cognitive reserve is associated with better cognition at baseline. It also appears to be predictive of executive functioning and language functions over time. However, for memory performance, we see that it's actually associated with a sharper slope of decline, similar to what's observed in Alzheimer's.